Oh, thank you if you've come back again. This is still our thinking for Wednesday the 29th of April. We're just getting a bit long, and I've had difficulty uploading some videos if they're too long and then they just don't seem to upload. So anyway, so I wanted to carry on thinking about the European situation now. Now, Italy, of course, has suffered dramatically and suffered early from this pandemic. Over 200,000 cases and 27,000 deaths as of yesterday's figures. Now, we've already looked at Italy and the way it's reopening, so I'm not going to do it in detail now. So lockdown for 7 weeks, parks reopening, takeaway food opening for next week. So restaurants can open, but people can't sit in, they can just do takeaway foods. 18th of May, the museums plan to reopening. Schools remaining closed till September, so they seem to have made a decision on that. Social distancing remains en masse in public places. Now, we've looked at that already, so I'm not going to dwell on Italy, but Spain, also a fairly similar strategy, really. So let's look at Spain, and then I'll tell you what I think this means. So Spain, as we know, a lot of cases and a lot of deaths. Now, the testing in Spain's been pretty good. 21 tests per 1,000 people, over 1 million tests performed. They still need more, of course. The more tests that they have in Spain, the safer the reopening will be. Children are currently out for an hour a day. Now, the plan in Spain goes over the next couple of months. So it's a phased reopening over the next 6 to 8 weeks. Hopefully 6 rather than 8, but we'll see. And they've got mapped out phases. Now, phase 1 starts on the 11th of May with more shops opening, as things starting to open in phase 1. Phase 2, the Spanish are hoping to open restaurants and hotels, but this will be with limited capacity. So social distancing will be maintained. Phase 3, they want to open shopping malls, again with 50% capacity. Social distancing will have to be maintained. Now, they do stress that these are flexible. If they need to go back a bit, then they will if they need to. So this is an expected and a hoped for phased reopening. And phase 4 will be a new normal. Now, what this means is that there's going to have to be changes in the way that we work, changes in the way that we socialise, social distancing, increased levels of hygiene, all the preventative measures that we know about, and that's going to have to continue until there is a vaccine. So a new normal for the remainder of the year is the aim. This is just something the whole world is going to have to get used to for the time being. Now, different regions in Spain are going to have the same stages, but with different timings. So this is going to be dependent on the severity of the problem in a particular region at the time that the reopening is happening. So some regions might be on phase 3, while some regions might still be on phase 1, or different times for different regions. It's going to be individualised, and this makes a lot of sense. This is the way countries are going to need to go. So, for example, Maine may have a different reopening schedule to New York, of course, because of the different stages at which they've been afflicted by the pandemic, and each stage will be evaluated to see if it's going to go ahead. So the Spanish approach there makes quite a lot of sense. Let me just, before I tell you what it means, let me just do the French one as well, because France is on a fairly similar trajectory really to Italy and Spain in terms of reopening. Now again, a lot of people have been ill and died in France, we know this. French testing, relatively poor. Only a tiny bit better than the UK, in fact. Nothing like as good testing as Italy or Spain. I must say I'm surprised that France has not instigated more testing. It's a very advanced medical country. Now, President Mitterrand has said the lockdown has saved 62,000 lives this month. So that's what his mathematical model is telling him. I've no reason to doubt that figure. So in other words, that could be 85. That could have been 85,000 without lockdown measures. So a lot of lives have been saved, no question about that. But of course, the cost has been huge. So talking about primary schools reopening on the 11th of May, again, I think that's going to depend on the area of France. Again, the president's talking about this new normal. We learn to live with the virus because we're not going to get rid of it until we've got herd immunity. Herd immunity will only happen when everyone's had it or when there's a vaccine. Different reopening schedules in different regions, again, makes perfect sense. So some areas might be reopening sooner than others. Economic activity might be safe to restart in some areas before other regions and other areas. So that makes perfect sense. And people aren't going to be allowed to travel more than 100 kilometres from home. So while travel is going to restart within France, you won't be able to go from Paris down to down to the south of France, down to Marseille or somewhere like that, or Montpellier. For a quick drive down. It's going to be 100 kilometres from home. Now let me explain what Europe seems to be doing here, because I think I've kind of worked out what the strategy is, and it's a bit complicated to explain, but we'll give it a go. So what they are saying is, right, we're going to reopen, we're going to start reopening things, and that's going to mean there's going to be more cases. We know there's going to be more cases. Now we're going to titrate that level of cases, and if the cases get too high, then we'll have to start closing things down again. So things will start closing down again. And they're going to titrate that against the ability of the health services to cope. So this is certainly the plan in the UK. So what this means is, if these are the this is the graph here. This is cases, and that's time. And let's suppose this is the ability of the health service in the UK or other European countries to cope with the amount of sick people that are going to develop. Because we know that as reopening occurs, there's going to be more spread, there's going to be more cases, therefore there's going to be more people with complicated disease, with severe disease, and some with critical disease. This is inevitable. This is known. So what could happen is that if we're there just now, and suppose the cases have levelled off, then we want to start reopening the economy, of course. And when we reopen the economy, cases are going to go up. And what we can have is we can have the cases going up to the point where the health services can cope. And then that's going to keep the case fatality rate down as herd immunity develops. Now, I know this is easy for me to say. The reopening is going to mean more cases, more severely ill people, more deaths. There's no way around that. But there again, the lockdown is going to cause economic collapse. So I can see why governments are doing this. Now, suppose that Spain moves from, say, phase 3 to phase 4, and that goes up above the ability of the health services to cope. Then they could go back to phase 3, and that would bring it hopefully down again. And they can just keep. So basically what we're saying is Europe seems to be on a schedule where it's titrating the increasing cases with the level of lockdown required. But of course, quite a few European countries, unlike my country, are mandating masks, which I think will help. Masks are such a simple intervention. So all our public areas, people should be wearing masks so that infected people aren't going to infect non-infected people. And we need to dramatically increase ventilation in public areas. So all the doors and windows need to be open. And this seems to be such an obvious thing that people just aren't doing. You go into a supermarket and the doors go zzz, zzz, like that. Why not have them open all the time and get as much air blowing through them as possible? Because that's going to dilute the virus. Because as we reopen, people with the virus who are... I do hope that no one who's symptomatic will go shopping. That would just be bordering on criminal negligence in my view. I do hope that's not going to happen. But people who are incubating the virus and are pre-symptomatic, or people that are asymptomatic, are going to spread the virus in public transport and in supermarkets as we reopen. No question that's going to happen. No question that's going to happen. So if everyone wears masks, then that means every single person wears a mask. That means every single person who is infected will be wearing a mask. And therefore they will be shedding less virus. And we know this. Why don't we do it? Now, Scotland has been recommended but not mandated, but I'm pleased to see it's being mandated in other countries. But I really appeal to my government to do this, Public transport and supermarkets need to be well ventilated and everyone needs to wear a mask. I've said it before. Probably say it again if I need to. Now, I'll just show you an interesting slide here on testing, actually. Now, I was going to follow through with this with the report on Vietnam, but I've simply run out of time. But we've looked at testing quite often in terms of number of tests conducted per 100,000 people in the population, which of course is interesting. But here we see number of tests conducted against number of confirmed cases. And we see that Vietnam is way out in the lead. So for the number of cases they had, Vietnam has been doing way more testing even than Iceland. And we know that Iceland has been doing the greatest number of tests per 1,000 people. But of course, Iceland had less cases. Taiwan also done very well, and New Zealand on testing, and Australia indeed. So it may be that this number of tests performed per confirmed case is actually an important metric that we need to start looking at more as we look at how we're limiting the spread of this pandemic. So I thought that was interesting. Now, 2 countries left. I'm going to do a bit of a report on Israel and a bit of a report on Kenya. Now, Israel is interesting. Let me just show you some data from Israel. Now, I'll give you the link to this. It's a bit difficult because of the language sometimes. But this is the epidemiologic curve in Israel. So we see this is the total number of cases. So as we know, the number of cases gradually, quite steeply went up. And we also notice that this is a linear scale. Always check that scale, 500, 1,000, 1,500, 2,000. So that's the linear scale. So this is kind of what you see is what you get graphic. Now, the green are the recovered cases. So it looks like recovered cases are increasing quite a lot in Israel. And good to see that they're keeping data on that. And the new cases here in brown, we see are going up here. Now, of course, the cumulative additive number of cases carries on going up. But the key thing to notice here is that the number of cases goes up here. But then basically, if we follow the top of that brown line, it's going down. Pretty good trend there. So the number of new cases in Israel has gone down quite a lot. And as of the 26th of April, there was only 81 new cases in the 24 hours. That number there is 81 in case you can't see it. So a very encouraging level of control there for Israel, it has to be said. Now, let's look at it in a little more detail. Now, one thing that's been encouraging, now there's a lot of Palestinian workers normally go over the border every day or every week, mostly from the West Bank. I'm not sure about Gaza, but from the West Bank. And of course, we don't want them travelling between Israel and Palestine at the moment. So a lot of them have done is there was a scheme between the West Bank Palestinian authorities and the Israeli authorities that the workers could simply sleep at work. So a lot of workers have been working in the day and sleeping in their workplaces at night. So they can still work, they can still make money to support their families, which of course is what we want. But then they just sleep at work. But what is concerning is there's been a bit of an exodus for Ramadan. So a lot of Palestinian workers from Israel have been going back for Ramadan. So the amount of travelling is concerning, but hopefully because there's few cases in Israel, that's not going to trigger a big outbreak in the West Bank. I do hope not. So what this means is that, let's just look at that again. What I'm hoping is that because Israel's got the numbers down so much, that means there's less people that are infected in Israel, so that's good. And as people travel back to the West Bank, they're not going to carry the disease with them because the disease isn't there. So this means that the West Bank has benefited greatly from Israeli interventions. Now, I make no political comment, but my duty is just to report scientific fact. And I do hope that that is the case, that there is not a resurgence of cases in the West Bank as a result of workers going home for Ramadan. and may they have a happy time at home. So confirmed cases and deaths in Israel. Deaths relatively small in Israel, which is good. Now the starting random community testing in Israel. Now this is good. Anyone who's a researcher likes that word random, because if I pick a group of people, if I think, well, I want to do a bit of research here, I know what I'll do. I'll test you guys, but I won't bother testing you guys. In fact, tell you what, I quite like working with women, so I'll just test the women and ignore the men. So can you see my subjective opinions there is bringing in bias into the study. Now, of course, no researcher would be so stupid as just to test women and not men. But the point is we all have biases, and we need to get away from these biases. And the way to do that is randomization. So randomization is an absolutely key word to validity in research. We need randomized studies, because randomized studies, if they are truly randomized, can be extrapolated to the population, whereas non-randomized studies can't. So glad to see that they're looking at that randomization, and I'm sure the Israeli researchers will do a very good job of randomly testing people. We did see this in the New York study we reported on a week or two back, didn't we, where people were taking swabs from quite large geographical areas, and it gave us quite a lot of epidemiological data about New York. Now, the Ministry of Health has ordered 2.4 million serological tests. Now, these are the tests for the antibody. So the serum is the liquid part of the blood, and the antibodies that the immune system makes are in the serum, that is in the liquid part of the blood. Sometimes it's called the plasma. So sometimes it's called serum, sometimes it's called plasma. But when we're examining what's in it, we call it serological. It's just the way it works. Now, I don't know where they've ordered these test kits from, or if they're making themselves. I couldn't find that out, but I'd be interested to know that. And I don't know how good the test is, because, of course, the UK government ordered millions of tests and they didn't work, and we had to send them back. So let's hope that the Israelis are sourcing good quality serological tests so we can test for the presence of the antibody. That means they'll know who's had the disease, and that gives us, as we've looked at many times, invaluable ranges of information, stuff that we really need to know about. And apparently they're arriving in May. Now, new cases are going down, as we saw, less than 100 a day in that last one. The last one we saw was 81 cases in the day, wasn't it? Now, there's a few hot spots, neighbourhoods and towns, and these are under full lockdown, no one allowed in or out, which of course is exactly the right thing to do to stop it spreading to other areas. So some gradual reopening. Masks are mandatory in public areas, absolutely. Why don't we do that? Restrictions on numbers of people in stores, barbers have to wear a mask and use face shields, etc. So progressive reopening in Israel there, and it has to be said, quite a good level of success so far, which I'm pleased to hear. Now, just before we look at pictures, I've got some information from Kenya. Now, I was sent some pictures in Kenya. Where are they? Here. There we are. So this is the supermarket. So I think this is in Nairobi. So good to see the shields, of course. But everyone wearing a mask. So they can work out in Kenya that this is the right thing to do. But in England, we can't work it out. Follow the Kenyans, England, Britain, UK. The Kenyans are leading the way here. Do what they're doing. This is good practice. Again, we see the... Are you seeing the right picture here? Yeah, you are. So you're seeing the circles on the floor for the spacing, which is good in the supermarket. And here the mall is open, but they're restricting the amount of people that get into the mall, so there's plenty of spaces. Now, I do hope there's plenty of fresh air blowing through this mall as well. Because see that bloke there? He could possibly be carrying the virus and not know it. So the more fresh air that's blowing through this mall to dilute the viruses he's breathing out, the better. I hope that gentleman does not have it, but he may have, I don't know, and what's more, he doesn't know, and what's more, this guy doesn't know either. So he's wearing a mask, which is good, but the more ventilation, the better. Such a simple thing. And everyone seems to be wearing masks, which of course is excellent. I think that's all of those pictures from Kenya. Now, I just want to read you a little bit of news from Kenya here. So, and there's some good news and some bad news here. So there's a curfew from 7 p.m. to 5 a.m. We're absolutely obliged to wear masks outside if we have to go out. This is a resident of Nairobi writing to me. We must respect social distancing. Everything is closed except from supermarkets and pharmacies. So really very proactive organisation here from Kenya. I'm very pleased about this. Most people working from home, sanitisers and soap is available everywhere, to the point where a huge drop in waterborne diseases was observed in hospitals. Now, isn't this good news? So because everyone's sanitising and washing their hands, there's been a massive drop in waterborne diseases like typhoid and I don't think they have cholera at the moment, but salmonella and waterborne diseases, fecal oral diseases, food poisoning, gastroenteritis, diarrhea, vomiting. So good news, good news. Improved hygiene has had these brilliant knock-on effects. The crisis seems to have motivated politicians to invest in healthcare sector. Now, I'll just add a personal note here. Elite people in Kenya, when they get sick, will probably fly off to England or somewhere for surgery, or the United States. But with this infection, they can't do that. So they realise they're going to get sick with everyone else. So it's good, and so that's focused the mind, and they're spending more on healthcare facilities in Kenya, which is of course going to benefit everyone. So that's good. Ventilators are suddenly being bought. Now we know that ventilators are less used now, but they still have a role. Nurses and doctors' salaries have been raised, and ICU facilities have been built all over the country. Wow! So, good things. Now, this is also really good news. Deaths from road traffic accidents is down significantly, and now I wish I could give you the figures on that, but a lot less people. Throughout Africa and Asia, road traffic accidents are a massive cause of death, huge cause of death and morbidity and people being injured for life, and these are down. Cars and buses are supposed to be driven half empty, which is good. Supermarkets are limiting the amount of people in at any one time, which is good. Now we have to queue 1.5 metres. It's not enough. We need 2.5 metres. So the queues need to be further apart in Kenya. But at least they are separating. Wear masks, sanitisers and hands. So before you go in the supermarket, you have to wear a mask, sanitise your hands. Isn't that good? So before you go in the shop, you've got to make sure you've got a mask on and that your hands are sanitised, or you're not allowed in. Absolutely brilliant. Why aren't we doing that in the UK? I can go into supermarkets without a mask, without sanitising my hands. Completely unacceptable. Gloves are sometimes given away for free, so people can wear gloves when they're shopping, and their temperatures are taken before entering. So before you go into a shop in Kenya, you have to be wearing a mask. You have to sanitise or wash your hands, or wear gloves that you're given for free at the shop. And then you have your temperature checked before you go in. Common sense. It's a really cheap intervention. That doesn't cost a lot of money. So why aren't we doing that? I really don't know. Nobody is allowed to travel from one town to another except truck drivers. And we did see that truck drivers are being screened at many African borders now, which is remarkably encouraging. Food relief is distributed to the poorest households because many people do work hand to mouth, unfortunately. People being afraid to seek treatment for other common diseases such as malaria. So Mombasa, for example, by the coast, there's quite a lot of malaria. So people suffering from malaria not being treated, that is very concerning. We have to get the messages out that other diseases still need treated, because malaria, of course, you can get cerebral malaria, it can kill you. It's a serious disease. The government have had to appeal to people and remind them that COVID patients are treated in designated hospitals away from other patients. So other hospitals are open. So this is good. So they're segregating the healthcare provision for COVID and non-COVID patients, whereas in my town we're treating them both in the same hospital. Okay, they're separate wards, but they're still in the same hospital. whereas the Kenyans are using separate hospitals according to this email, so that's good. Quarantine wards have created some levels of fear and stigma, which is not good. So there's no, I mean, this disease has no stigma, it's just whether you get it or not. Now, I'm not going to, let's just say the police are enforcing this strictly in Kenya, especially at night. It's being strictly enforced. Now, people are allowed to go to the Nairobi National Park, just outside Nairobi. 3 people from the same household in one car with masks. Now, this is other good news. Pollution has gone down so dramatically that we're able to see Mount Kilimanjaro and Mount Kenya. So Mount Kilimanjaro is way down in the southeast of Kenya, and Mount Kenya is way across in the east. No, in the west. Mount Kenya is towards the west, on the other side of the country. So from Nairobi, you can see Mount Kilimanjaro and Mount Kenya because the pollution's cleared. So less waterborne diseases, less pollution. People can see Mount Kilimanjaro, Mount Kenya, and less road traffic accidents. So there you go. Interesting. Now, time to look at some of the pictures sent in by my wonderful viewers around the world. So this is Andrew and Denise in Devon, and they watch in bed in the morning before they get up. Now, it is a slightly concerning picture here because I do hope they have a tea making machine beside their bed. Otherwise, they'd have to wait an awful long time before they get their morning cup of tea. I'm sure they do, and they drink tea while they're watching the video. So, excellent picture, Andrew and Denise. Thank you. Now, this is Violet the Bull Terrier. I just love those dogs. And Brett, who I'm not sure where Brett and Violet are at the moment, but thank you for sending the picture in, Brett. Great dog. Now, this is Carol and Jody in Canada. And it looks like they're about to drink something red and quite tasty there by the looks of it. So, excellent. I'm sure you're drinking in extreme moderation, Carol and Jody. So thank you for that. This is Catherine. Now, Catherine's actually Canadian, I believe, but lives in northern Thailand. So you can just feel the heat there when you look out the window, can't you? So, lovely part of the world in the woods in northern Thailand. Thank you for sending that in. Thank you, Catherine, for sending that in. Great picture. This is Dana in Canada. It really is. It's quite moving and humbling the way people invite you into invite me into their homes. It's great. So thank you for that picture. Thank you, Dana. This is David in Lithuania. Is that a symptom tracker down there, David? I wonder if you've been ill. I'm not sure. Anyway, thank you for sending the picture in from Lithuania, one of the Baltic states. Good to know you're watching there. This is Deeran and family from India. Not sure what part, but great to know you're watching in India. You know, it's just, if you're young, you won't understand this, but for me, the internet wasn't invented till I was quite old. So it's just amazing that people can just watch all around the world. Just the internet is incredible. Well, I was working in Asia in the 80s, and the only way you could communicate with people at home was sending them an aerogram. We couldn't afford the telephone. It was far too expensive. And take a week to get there and a week to get back. Whereas now it's all just wonderful. Yeah, the internet's a great thing. And of course, this is the first proper internet pandemic, which is also quite interesting. This is Donna, who's watching in Spain. Spain, of course, suffered a lot and quite early from this COVID-19 pandemic. So I do hope you're well, Donna, and thank you for watching in Spain. Now, this is Pebbles, who lives in the same house as Elisa, who kindly sent this picture in. Thank you, Elisa. Seems to be quite popular with cats and dogs. Oh, there you go. As if we needed further proof. That's Winnie watching, who is owned by Emily. So thank you, Emily, for sending that in. This is Jason and Gizmo. Seattle, yeah, in Washington State, which was one of the earlier epicenters, wasn't it? Seattle always reminds me of that film Sleepless in Seattle for some reason. This is Laurie, Christina and Lance. Good to see you watching as a family in Colorado. You know, you could turn me off and probably look out the windows and be looking at the Rocky Mountains, so it's nice to know you're watching there in Colorado. Excellent family picture. Thank you for that, Laurie, Christina and Lance. This is Tariq watching in London. So London, as we know, has been quite badly affected. Hope you're well in London, Tariq. Thank you for sending your picture in and thank you for watching. This is Valentina in the United States. Now, she's in an outside area, but I'm glad to see she's wearing a mask as practice. So thank you for that, Valentina. Clearly watching on some mobile device outside. The wonders of technology. But these pictures just go to show that this is genuinely a pandemic. We've got people basically here in solidarity all around the world as we try and combat this wretched virus together, as indeed we will. But quite nice, very moving really for me to see people watching all around the world as it is a pandemic. Okay, thank you.